Today, we're going to talk about something that all of us have suffered from at some point in our lives: headaches. We might have all had headaches, sometimes after a night when we did not sleep quite well, or often at times when we were stressed about an exam or an interview, or otherwise when we have traveled a lot, or otherwise when we've been out in the sun too long. You may also have had headaches when you've not eaten a while or when you've not had enough water. However, sometimes these headaches can be recurrent and they can cause stress. As you know, nowadays we see a lot of cases of cancer and tumors all around us. And I'm sure many of you would have thought of cancer as a differential diagnosis when you had headaches which were disturbing and which went on for longer than you expected them to continue for. So let me tell you what are the major factors that you need to remember about headaches. First of all, headaches are mostly benign. You could either be predisposed to having migraines, or you could be having a headache because your sleep quality and quantity is not optimal. But when can this headache be sinister? Or what are the red flags that we need to consider? So headaches could be a symptom of tumor or brain cancer in the following situations. Number 1, the headache is associated with visual blurring or seeing double, that's double vision. Number 2, the headache is associated with vomiting, and that too projectile vomiting whenever you have a headache. Number 3, it is associated with both of the above, that is visual blurring as well as headaches. Number 4, the headache is associated with seizures. Now what is a seizure, you may ask? A seizure is when you have what is normally called a fit. Now seizures can be of various types. You can have a generalized seizure when your entire body, all 4 limbs are moving in a tonic-clonic way, which is something like this. Or you could have a focal seizure when only one hand or corner of the mouth or one leg is having tonic-clonic movements like this. Alternatively, you can also have a dialectic seizure when you are just staring into space and not talking, sometimes blinking your eyes, or sometimes just the corner of your mouth twitches while you're staring into space and not conscious or aware of anything that is happening around you. So that's number 4, if your headache is associated with seizures. Number 5, your headache is associated with new onset forgetfulness. Say you were absolutely alright and now suddenly you have a headache, plus you are forgetting things, plus you have personality issues. All of this comes from the frontal area of your brain, and this headache may be associated with a tumor. So now you are aware of the 5 conditions in which your headache would be associated with a possible tumor. The 6th is very obvious, and that is hemiplegia or hemiparesis, where one part of your body, either the right or the left, is not moving or moving less than before. If none of these conditions are true for you, then your headache is most likely benign. And trust me, benign headaches are more common, much more common than the ones that happen because of tumors. So if you have a headache, I would recommend get evaluated by a neurologist, rule out simple conditions like migraine, and please get your sleep evaluated, because it is more likely that you have migraine or a sleep issue. And if you're worrying about tumor, you should worry about both of them first. Thank you.